Thank you, Canada. I now give the floor to Lebanon, to be followed by France.
Thank you. Esteemed Chair and Member States, on behalf of Lebanon, we express our gratitude for the ongoing efforts to improve emergency preparedness and response, and for the commitment to enhance the implementation of international health regulations to safeguard populations from risks and emergencies. We reviewed the IHR Committee's standing recommendations embedded in document A77-8 and its addenda, especially the convening of a special committee to advise on recommendations for long-term risks posed by the COVID-19 pandemic. We also extend our appreciation to the Independent Oversight and Advisory Committee and share their concern that the demand is likely to substantially increase in the face of the growing number of grave emergencies across the globe. In addition, we invite all of us to strengthen the WHO Health Emergencies Program and to further support the IOAC to continue to monitor and scrutinize the program's operations. Our region continues to face significant challenges with public health emergencies. Lebanon, in particular, has been struggling with a multitude of crises, including the Syrian refugee crisis and the recent multiple outbreaks. In response to these challenges, our National Health Strategy Vision 2030 stresses on the importance of investing in emergency preparedness and response with a focus on strengthening epidemiological surveillance to fulfill our IHR obligations. Furthermore, and as part of our commitment to enhancing emergency response and coordination, we have activated our Public Health Emergency Operations Center. Our work facing the emergencies is ongoing, and we are thankful for WHO's support to Lebanon, and we reaffirm our commitment to collaborating with the international community to strengthen our preparedness and response to public health emergencies. Finally, ladies and gentlemen, facing the rising geopolitical instability, we fully endorse the recommendations of the IOAC that WHO's role should remain at the center of the global architecture for health emergencies preparedness and response, and that WHO's Secretariat is best placed to act as the Secretariat to the Conference of the Parties.
Thank you, Lebanon.